A big shakeup today in U.S. climate policy. The Trump administration just erased the government's main scientific foundation for fighting climate change, repealing an EPA rule that classified carbon dioxide and 5 other greenhouse gases as a threat to public health. That rule has been at the heart of climate regulations, setting emission standards for cars and light trucks, power plants, gas and oil facilities, and other major polluters. Experts say undoing it could unravel years of environmental protections and lead to a barrage of court challenges. It marks the most sweeping effort yet to dismantle climate policy, and legal experts warn it could cause more chaos than any of the Trump administration's previous rollbacks. Joining us now to discuss what this means is NBC News medical analyst, pulmonologist, Dr. Vin Gupta. Thanks for joining us, Doctor.
Good evening, Joyce. Thanks for having me.
So when you heard this morning the EPA reversed this ruling, what was your first reaction?
Well, Joyce, you and I have been having these conversations for 12 months now on norm-breaking policies when it comes to public health, but I think this is perhaps the one that just doesn't make any sense, even when you add in that everything in healthcare has been politicized. Clean air is the very definition of something that is not political. Our vaccine policy has become political, healthcare access has become political, but nobody wants to make an issue or shouldn't want to make an issue of clean air because it's an air we breathe. And this is impacting the health of developing lungs, it's impacting the health of those that are at risk. Quite literally, it's politically blind. This is not an issue that should have to change every 4 to 8 years, but it is. And so I was surprised. I think about the patients I care for, Joyce, and many of them have very different views when it comes to public policy. All of them want clean water, all of them want clean air, all of them pride themselves on being in the outdoors. And so I suspect that this public sentiment for what's happening and public understanding of what's happening, that's why we're having this conversation, but public sentiment is firmly against this. Nobody wants this.
Let's talk about public understanding, though, about what this means. From a health standpoint, how could this affect the air that we breathe, especially here in the Northwest?
Well, Joyce, over the last 50 years, the greatest public health initiative we've ever seen, you could argue, is the Clean Air Act. Our air quality in big cities and even in suburban counties is about 80 to 90% cleaner than it was in the 1960s and 70s, Joyce. That's clean air regulations as it applies to smokestacks, as it applies to tailpipe emissions, as it applies to so many other parts of society. It's cleaned our air. We no longer have acid rain. We no longer have just smog-filled cities. Yeah, there are some exceptions. Yes, of course, wildfire smoke is a reality in certain parts of the country, but largely we live in a very clean environment. What does that mean? Less asthma exacerbations, less ending up with a heart failure exacerbation made worse by breathing in poor quality air, cleaner water in our environment, which is good for animals, which is good for human health. All of that goes away when there's not federal law that is accountable to these rules. And that's really what's happening here. From public understanding standpoint, let's be clear, they repealed the endangerment finding today. What does that even mean? When you really dive deep, that basically says the EPA and the government is no longer responsible or accountable to making sure that we have measures in place to protect ourselves from greenhouse gas emissions. They're basically saying greenhouse gas emissions and the impacts it's having on our environment, warming environment, dirtier air, that those have no impacts on human health. That is what they're saying.
Something that you said off the top of this interview stuck with me. You said, it just doesn't make sense. If it doesn't make sense from a health point of view, why do you think the administration is doing this?
Well, the EPA has become the corporate profit protection agency, no longer the environmental protection agency. So one, that's what's driving this. The industry behind fossil fuel burning, behind gas-powered cars, they have long wanted this and they're getting what they want, number one. Number two, I would say this is peak irony. For those that are tired of hearing about MAHA because it's a marketing slogan, nothing when you really think about it related to substance. There's no substantive policy when it comes to MAHA. It's a great marketing slogan, nothing else. This is peak irony. We have an environmental lawyer as HHS secretary pushing forward, Make America Healthy Again, right at the same time that his own EPA, his peers at the EPA, are saying we're going to make the environment as dirty as possible. You couldn't get a side-by-side that is as contradictory as that.
And finally, as we were looking at pictures of wildfires and we think of air quality and people who have health issues like asthma, et cetera, moving forward, the impact on public health, if these legal proceedings don't reverse this yet again, what's your biggest concern?
Well, hospitals are struggling. We have less bandwidth in the system, Joyce, to care for people in the ER and the general medicine wards and the ICU. And we're basically saying we're going to increase the number of risk factors for people to end up in those very places because the air is going to be dirtier. Wildfire smoke will be much more common. As we roll back a lot of these protections, it's going to get warmer out there. It's going to get dirtier out there. Water will be dirtier as well. That means more people are going to be at risk.
Dr. Vin Gupta, we're out of time. We so appreciate your insight. Thank you so much.
Thank you.